Welcome to Public Health Matters, where we talk about matters in public health. I'm Jane Goodman, Public Health Strategist with the Nashua Division of Public Health and Community Services. I'm so happy to have our guest join us today, JeanaMarie Lopez-Carrasco. Did I do that right, Jeana?
You did, yes, thank you.
Jeana's our head nurse for all of the District of Nashua, located at Elm Street Middle School.
Yeah, that's my home school.
Yeah, and just because it's July, it's the end of July, so we want to bring you on early to get people prepared, because August is right around the corner, and there's a lot of things parents really need to do to get kids ready to go back to school. And a lot of them have to do with health and wellness, so we thought this would be a great opportunity for us to really talk about what to do to get ready to head back to school.
Perfect timing.
And it has been quite a year, because the kids really didn't go back to school until around April.
April.
And we have some kids in summer school right now. How is that going?
Doing excellent, doing very well. We have a lot of the ELL children there. Mm-hmm. We have the special needs kids. We have kids that are just coming for different programs that they have throughout the district, CET program, and they're doing very well. They're excelling, and they love just being with each other.
Mm-hmm. They're happy to be in school.
Very happy.
Even though it's the summer.
Even though it's the summer.
Okay, well that's
Well, they
good.
only go half a day, so that's
okay.
and then they get to go home.
So they get a little bit of a break.
Yeah.
So the biggest thing that comes to mind for me back to school is that kind of the annual physical, which I know you probably recommend, and I always say the dreaded shots because of my own experience with my children. Mom, am I getting any shots today? But immunizations are really critical as we get back into school, and some kids lapsed, over the last year. So we're going to talk about immunizations first and foremost.
Sounds fantastic.
And so why do we need immunizations? Can you just explain that to us, to the lay people?
We need immunizations to really help the population get those immunities so they don't get contagious, diseases. Mm-hmm. Really, really important to, as in elementary schools, to get the basics, the Tdap, the polio, the MMR, the varicella, just to get that foundation. Also, when it comes to middle school, this is a big thing which we can talk about, is it used to be that sixth graders needed a Tdap, which has the tetanus, but it also has an element called pertussis, which promotes whooping cough. And that is a big thing, with the winter weather coming. So to prevent it, the state has required all seventh graders coming in to get the pertussis, that Tdap, to get that pertussis element, so they'll be able to continue throughout their middle school and high school years.
Right, and we do not want whooping cough to come back.
Definitely
it is
not.
really a dreadful disease to have to deal with. So we have a lot of immunizations that are required, and I do have a chart that we can pop up periodically while we're talking about them.
Sure.
But what's interesting about a lot of these is, we don't hear about cases of these anymore because we've reached some kind of herd immunity. So if we could just talk briefly, because we hear herd immunity a lot in the news around COVID-19, but we've been talking about herd immunity in public health for a long time. It's not just something in the last year. So we wanted to have herd immunity around polio, for example. Years ago, I had a teacher who was a polio survivor. So you don't hear about it as much.
Right.
And I just want to give people a definition of herd immunity.
Sure.
So it's when a large percentage of people become immune to a disease, and therefore they protect those who do not have immunity. So if 4 out of 5, just a layman's example, if 4 out of 5 people who are exposed to someone with an infectious disease are immune to it, the disease is much less likely to spread.
Definitely.
So it's important that all the kids that are in close contact in a room are all vaccinated. And in fact, this is law in New Hampshire.
It is. It's a New Hampshire state law.
Tell us a little bit about that.
So we work in any school nurse, especially in New Hampshire, work very closely. We work with the public health department, but also under in Concord, they have an immunization program, and there's certain mandated immunizations that are required to come into school. For example, the DTaP, for the little ones, they have to have either 3 to 4, with the last one being after age 4. The polio, as you mentioned, 3 to 4. It all depends where they are in their line of getting them. with the fourth one being after the age of 4 also. They have the measles, mumps, and rubella, which this is very important. You usually get a booster. Used to be coming into middle school, but now they've advanced it into the younger grades.
Okay.
So when they're coming into middle school, they already have the MMR. We see some children that are coming from different countries and they'll only have the measles. So it's very important to have the 3, the measles, mumps, and rubella, to make that unity, for that immunization and that herd immunity. Varicella's another big one, which is chickenpox, right?
I wish they had that when I was younger.
I know, that's an important one. A lot of people coming different countries don't require them, and that's something if they get, we look in, we make sure that people, in the school, everybody's been vaccinated, because that's a big spreader. And you need 2 of those also, not just 1, but you need 2 to back up. So that's another big one, 2 varicella. And I think we have Hib, but that's usually when they're younger.
Hepatitis, I see.
Hepatitis B, which you get 3, you get 1 at birth, and then you get the other 2 as you, the 2nd and 4th, months. But if you come into the country, you don't have those. It's a series of 3. With between the 2nd and 3rd one, it's 6 months in between to get those. I know it's a lot.
It's a lot, and there's a lot of different ages and time frames. So I just want to know what the secret is that the school nurses have. I know they're very busy doing, a chart review.
Yeah.
Do you have this stuff electronically now, or is this still combing through every file that's sent to you? Or, that's a lot. If you have a lot of students in the middle school.
Work. Well, we have a wonderful program in the Nashua School District called Aspen or X2. And what happens is that when a student comes in, we physically log all the immunizations that's given to us from either the parent or the doctor's office. We physically put it in, but we also keep running logs. Each nurse has a different procedure how they do it. Like, I'm a very visual nurse, so I have pieces of paper that says, okay, this person's due at this time. But the computer also flags if you're due for your Tdap, for example. Like, I'm a middle school nurse, so it'll flag that. But it's so important because also the state requires the school nurses to fill out a state survey. And so this is how they document throughout the state, like who has their shots, who is in the process getting shots, if there's a child that a parent decides to do like a religious exemption, or a medical exemption also if someone is, physically not able to get a shot.
Sure.
We have that all documented. So it's in there, so each child has an electronic health record.
Okay.
And that's kept. And we also...
I feel so much better for you now, because I kept picturing like these files and culling through that and all these different times.
Yeah.
Like, this was a great thing for software to take care of.
Right. We also have a backup though, so each child gets a folder.
Okay.
And so we do have the physical record there, like the physical and everything, just in case, because everything is, not foolproof,
Right.
So, but it is in the computer, and the Nashua School District has a backup, but we always, we have a physical record for it too.
So right now, our school nurses calling families to say, I've noticed you've been flagged, you're missing the Tdap, you're missing this, and they let them know.
Yeah, especially as you mentioned with COVID, a lot of the children, were doing remote or homeschooling, and now everybody's coming back, and it's just like we're playing catch up. And we're so grateful for the National Public Health Department because they're providing these clinics for us, that these children can go and get updated right away.
And we'll talk about those. We'll do a big push on those. But we'll come back to those. So one thing we were talking about before the show and a little bit yesterday when we were getting ready was that 7th grade, and you started to mention it, but there were 2 other vaccines you also wanted to get out there for 7th graders. Was the Tdap. And then you had mentioned just now Menactra. And if I can do it, what's HPV?
HPV.
So I did it.
Yeah. So just a few years ago, it was the 6th graders coming in would get the Tdap. But what the state looked at, that the children really need to have, the Gardasil, the HPV, and the Menactra to get them ready, for high school and, because they're maturing in with the things out there. So what they decided was it would be a great opportunity for them to switch the age group to 11 to 12 when they go for their 7th year physical. That's when they're encouraged, they'll give them the Tdap, but they're also encourage them to get the Menactra and the HPV to get them started on that series. And it's been, the majority of the children are getting it, and it's really making a difference as they get older.
And it's great when you don't have to have people come back for something.
Right.
Because that's when we lose people. We always try to shorten that time to coming back, or, that's a challenge we have with a lot of things. But if you can get them all in that one visit, the kids aren't so happy, but
I know.
but it accomplishes a lot.
It does, and it makes a difference in the long run for their better health.
Yeah, and you had mentioned you have like over 200 kids that need a Tdap right now.
A Tdap right now. That's in the 7th grade.
So got to make those physical appointments, because you also want them to have a physical before entering 7th grade as well.
Definitely.
Aren't there a different timing for high school as well?
So definitely, and it's sort of eased up. We do require, it's not mandated, but it would be really nice if we have an updated physical for middle school. Especially if the student's going to play sports. They cannot play sports unless they have a physical.
Okay.
So that's super important. And usually they'll get another big physical when they're in high school. But it's every 2 years for the sports.
Okay.
So if you're having your routine physicals, you're all set. And it's always good when you go to the doctor's office to always get a copy for the school nurse. Sometimes they forget that.
Yes. I always ask that before I leave.
Yeah.
They think I'm crazy.
Can I please have a copy? Yeah.
But it's just easier that way.
It is, and then everything's documented, and I've had some moms call me when children have graduated high school and said, "Do you still have that documentation on my child's immunizations or that physical?" And I'm able to pull it up on the electronic computer, which is a blessing for them.
Right. So that's great. So we have it. We have backups of our backups.
We do.
And they're at the school too. Who knew?
At the school.
So this is just great information. What else do we need to do? So we got the shots.
Yeah.
We got the physical. What else should kids be doing to get ready for school, or parents helping kids to get ready for school?
So probably getting back on a schedule is really nice. I mean, go back to the basics, just like when we were in COVID. Also keep up with the hand washing. No touching your face. Biggest thing is to get on a sleeping schedule. We find a lot of the children are so tired because they're so used to staying up late at night and not getting up early. So that sleeping, and children, they need at least 8 to 10 hours of sleep so they can, function properly in school. That's a big thing. Hydrating, drinking enough water. In school we see a lot of kids that have headaches, and it's because they're not hydrating enough. That drinks, the juices and stuff are wonderful, but water is like super important to keep us all hydrated and healthy. And just eating like balanced vegetables, meals with vegetables, protein, a little bit of carbs and
starch.
And the 3 meals. I mean, we see a lot of kids coming into school that are not eating breakfast. I mean, we're blessed that the school provides breakfast, but a lot of times they'll come in for snacks. And, just in the morning, you need some energy to, start thinking and getting your brain functioning. So those basic things are just, really important to start, now, or the beginning of August.
Yeah. And
Maybe not till now.
August is soon. It's very soon. It's in a few days. So, and this will play during that time. So hopefully people will take you up on that and get kids on a better schedule.
And another thing I forgot, exercise. Super important. Even if you go around the block a couple times, just keeping, your heart pumping and, exercise really, will make a difference also.
Gets the brain working a little better too.
And it does.
Little biking maybe.
Yeah.
You can bike around the block.
Anything.
Be careful, wear your helmet.
Wear your
if
helmet.
You're going to bike.
Wear your helmet.
Public health shout out. So you make me think of something else. I wanted to talk to you about the COVID vaccine. We know it's available for those 12 and up.
Yes, the Pfizer.
And
also,
we are advising that if you're comfortable, please get this. And so what have you seen with kids getting the vaccine? And
so we've seen a lot of kids. I mean, the National Public Health Department has provided us opportunities to get it. We've gone into the high schools and had opportunities to, get the vaccines. And we've seen a lot of a lot of more relaxed, you know, parents and children, because they know that they're protecting themselves. And it's just, I think they have, you know, more emotional security because they know that, you know, they've had that vaccine. We've seen a lot of people, you know, that get the J&J, you know, the parents have, you know, questioned us, and we provide those at the health department also. It's just, you know, not for the children, but, you know, for the older, you know, the moms and dads and stuff. But it's really, you know, and we actually document that. We went to our IT because that wasn't part of our drop down, and we said, can you put COVID? So we're able to actually document
that's great.
those dates. So if, you know, they have any questions, or, you know, even the doctor's offices, you know, I've had parents call me and says, oh, I know I came to your school. I know I went to public health, and I know we gave you the dates. Could you get us a list and provide, so we can provide it to our PCP? And that's been helpful also.
Right, and there's a new thing in New Hampshire. This must affect you, because now we have this new immunization database. We are the 50th state in the nation to really catalog our immunization. So is the school have some responsibility to that as well?
I think eventually. I think
not yet.
Not yet, but as far as I know, I think everything's going to link together.
Okay.
And this is the beauty of it.
You haven't gotten that letter in the mail yet.
Not yet.
Maybe not check your mail right away.
Not yet.
Yeah. So I mean, because that's really, for me, I was like, well, it's about time that we can know statewide what our immunization rates are for all of these childhood, I don't want to say diseases, but adults can get them too. But for all of these things, you know, what can we protect against?
Right.
And how well are we doing? And we do have a good rate of immunization among children in New Hampshire, but it can always be better. And so we want to just make sure that we can track that adequately. So anything else you want to tell us for our kiddos and our parents before they get back to school?
Just get excited. I mean, summer school's going really well, and the children are surviving. And the one thing is they just love seeing their friends. They just, you know, just socializing and, you know, trying to get back to this new norm. And just, you know, still doing the, you know, the hygiene, washing your hands, and, you know, just being aware of your spacing, and, you know, doing what you need to do. But it's exciting.
It is exciting.
Everybody's excited for this new school year.
It's like it's a reset.
It's a reset.
And let's just go. Let's go to school. So I do want to give some folks some information. We have a few slides we can pop up just so if people want to jot this stuff down.
Sure.
We have several vaccine clinics coming up. So if you're not able to get to your physician, your primary care doctor, your nurse practitioner, whoever sees your children, we do have some at Nashua High School North on August 19th from 3 to 6 p.m. So I don't know if you're involved with any. I bet you'll be at all of them,
Many
Jeana.
of the school nurses will be there.
It's great. And we appreciate that help. And then we'll also be at the Merrimack High School from 1 to 3 on August 11th. So that is another opportunity if you missed the Nash one. Actually, that one is before that, so we probably should switch that around. And we'll also be at Nashua Public Health starting Tuesdays from 4 to 7 p.m. and Fridays from 9 to 12. So our office is on 18 Mulberry Street, and we are in a new space, well, a new old space, fully renovated, and we're really looking forward to welcoming families to get their immunizations with us. Again, Tuesdays 4 to 7 and Fridays 9 to 12. And you can find that schedule on our website as well. And then one other thing, which I'm not sure if you'll be at or not, Jeana, but we have a Nashua Goes Back to School event on August 26th. So that's a little bit out in the distance, but you know, a lot of people will attend that to get some school supplies and to meet the principals and to meet their teachers, maybe the school nurses. And so it's an exciting time for them. So what we'd like to do, if parents do show up to that event, we want to let them know that they can make an appointment to come back the next day on August 27th. Our clinic will be open a full day, and we'll get those immunizations done.
Wonderful.
So
wonderful.
That's just I hopefully it is a great service to the community, really important service, so we get these kids safely back in school.
Yes, and we appreciate it because it's so important to immunize your children.
Yeah.
You know, just keeping them safe.
Right.
Keeping them safe.
Right. It's right up there.
It definitely
It's right
is.
up there. So Jeana, thank you so much.
Oh, you're welcome.
For coming.
Thanks for inviting me.
And I know that you're super busy because you're still, like you said, summer school, you're checking all those charts, you're calling parents. So thank you for all you do for our community,
Thank
for the
you.
Nashua community.
It's a pleasure
And
honor.
Oh, well, thanks.
Thank you.
So we'll see you. We'll see you on the streets, actually, because I'll be at some of these clinics
Yeah,
as well.
I'll be there.
I'll definitely be at back to school.
Oh, good.
So
I'll be there too.
All right. Take care.
Thank you.
And thank you. We'll be right back.
I got my COVID-19 vaccination, and here's why. This isn't about gimmicks or sentiment or what commercial I like. This is about facts. COVID-19 vaccines are safe and effective. Millions of doses have already been given in the United States, and these vaccines have the most intensive safety monitoring in U.S. history. When you need more information, use a reliable source like the CDC website, and get the facts.
I got vaccinated
to help protect my family and friends.
I'm getting vaccinated because it's a first step for our community to go back to normal life.
I'm getting vaccinated because I want to protect my friends, my family, and everyone else in the community.
I've been vaccinated because I want to visit our daughter Caroline and her 2 kids, and because I want to keep our entire Nashua community safe.
We got vaccinated so we can be together.
I got vaccinated because we needed change. We needed to go back to how things were before, and this is how we do it.
Olá, eu tomei minha vacina para minha própria saúde, para o meu próprio bem-estar, também para minha família, proteger minha família, principalmente os meus netos, e também para continuar com a minha comunidade, voltar à minha vida normal.
We are getting vaccinated because it's necessary for the safety of us and the members of our church.
Al vacunarnos, rompemos esa cadena de dolor y muerte producida por el COVID-19.
Mes chers amis, je vous invite à venir vous vacciner. Moi, je me suis déjà vacciné. Pourquoi je me suis fait vacciner?
Niko hapa kuwasihi mpate chanjo ya COVID-19 ili turudi tulivyokuwa kabla ya virusi. Pata chanjo.
I got vaccinated for you.
And I got vaccinated for you. So roll up your sleeve, Nashua, and let's get vaccinated.
Welcome back to Public Health Matters, where we talk about matters in public health. I'm Jane Goodman, Public Health Strategist with the Nashua Division of Public Health and Community Services. And I'm joined today by our Division Director, Bobbie Bagley. Welcome, Bobbie.
So good to be back, Jane. Good to see you.
I'm glad you're back. This is almost like our annual show.
Oh, yeah.
We
it's
started
been a
this
minute, huh?
Yeah. We started this a year ago, just about. We're in our 2nd season, believe it or not. So I'm really glad that you could join me today.
Congratulations, Jane. You've done a fantastic job.
Oh, well, thank you. But it's been fun, and we've had some great guests over the last year. And we're always looking for more guests. So if you have a public health issue that you'd like to discuss and talk about on air, get in touch with us at the division.
Oh, yeah. I'll send you plenty of guests.
Yeah. So one thing we wanted to do just at the top of the hour is a little bit of a COVID update, and just want to let people know right now that we are in moderate transmission in New Hampshire. So we look at several metrics when we talk about transmission, and one of them is cases per 100,000 people. And our magic number is 50. And when we go above 50, we go from our beautiful green color to our not so beautiful yellow color. So
Yes.
unfortunately, yesterday, or 2 days ago, we went from minimal transmission to moderate, and it is unfortunate. A lot of things are going on. People are starting to travel again, and so we're seeing a little bit of a spike, but only time will
Let's
tell.
call that a bump.
Oh, what's a bump?
Let's
not
call
a
it
spike.
a bump for
Okay.
right now. And it is unfortunate that we have moved from minimal to moderate. And, we've worked really, really hard, as a community with our public health workforce, with the community, with everyone, trying to make sure that we kept everything at a rate low enough so that we could get back to doing all the fun things that we like to do, right? Getting back to travel, visiting with family, because so many people were getting vaccinated. And then we have a little bit of a lull right now, which we want to see this is where we really want to see the uptick is with the vaccinations, right? And so we had a nice group of individuals that were ready to be vaccinated, and you saw that need and that demand take off. And then we came to a little bit of a lull in that, and that's where we are right now, where people are still getting vaccinated, but we need to see, that's where we need to see the uptick and the uptake with folks getting vaccinated. So we're pretty good. We're up to like 58%. I believe that is the percentage where we are right now. But we need to get that up a little bit higher.
Yeah, so we'll talk a little bit more then about, right now we're seeing it in the news, we're talking about the Delta variant, and there are countries, this is really a global variant. It has really everywhere now. It is even in New Hampshire. We've reported 27 cases to date, which is not a huge number, but it's here.
It's here.
And it's in Australia, we've heard, Bangladesh, Botswana, South Africa, the United Kingdom. Of course, it was in India, which caused their extreme surge just really a month ago. We have short memories, but that's a country that's still really suffering through this pandemic. And we're seeing that it's 83% of all the sequenced cases in the U.S. So that's all the cases that they're testing for this. They're finding the Delta variant. So as a nurse and a public health professional, why are we more concerned about the Delta variant?
Well, with the Delta variant, what we're learning is that the R naught, so there is a phrase that's used by the CDC and by public health that looks at the transmissibility or the communicability of any type of viral infection. And so the R naught measures for each case how many other people will get infected. And so with coronavirus, when it first came out, we had the R naught at like 2 to 3. So for every one case, if someone came into contact, 2 to 3 people would become infected. With the Delta variant, that one is up to 5 to 8 times as more infectious. And so that's why, the concern is what it is. And that's why you've seen the numbers go up so quickly. So in New Hampshire, even though we've seen 27 cases of it, if you multiply that out, for each one of those, 5 to 8 times more is what we're afraid of, right? And so the more cases or more exposure there is to the Delta variant, the quicker this can go through our state. And so that's why we're encouraging folks to think about those mitigation measures that we had in place. You talk about our short memories, right? I think the thing is that people are just so happy that we've moved to this place where we are right now without having to wear masks, with, again, being able to come together, socialize, go out, enjoy dinner, get-togethers. And now we have this Delta variant that's starting to circulate, which we really have to pay attention to. Especially, Jane, you mentioned travel. So we may have only 27 cases in New Hampshire, but what does the rest of the country look like? What does it look like around our borders or the places that we're going to, if we decide to travel? And so when people travel, they want to keep this in mind, whether they're vaccinated or not. Hopefully, individuals that are not vaccinated will get vaccinated. But for folks that are not, when you have to think about that when you travel, what could you come into contact with, or what could you be exposed to during those travel times?
And you bring that up, and so it's a good segue because we do have a map that looks at where there's low vaccination rate and high infection rate. And so we'll just pop that map up so people can take a look where the dark colors are. Those are the places that are worrisome. So there are areas in Florida, some of the southern states, some of the Midwestern states are starting to pick up more of this Delta variant and more infections. So we just really want to encourage people, like you said, check before you go. Make sure that people are vaccinated or there's a high rate of vaccination wherever you're going. And if you're not vaccinated, really consider taking that step.
Strongly consider it. And when you travel, whether you're vaccinated or not, go into places where there's high transmissibility or increased cases, put your mask on, right? So we know that works. It reduces the droplets that are spread from one person, and it also blocks those droplets from coming to you. And so we're encouraging that. CDC guidelines have been updated with regards to mask use for individuals who are vaccinated, who are fully vaccinated, because again, we want to slow the spread of this Delta variant and exposure.
And there's some nuances to that change that we were talking about before we started the show today. And that is that if you, again, even if you're vaccinated, or if you're immunocompromised, or if you live with someone that's immunocompromised, and you're in those high-risk areas with high transmission, please wear your mask.
Yeah. And we're going to keep you informed, right?
Right.
So our public health nurse, Flavia Martin, who is our communicable disease champion, who, leads us in our information, our knowledge, and keeps us updated, did send out some information today, again, so that we can inform, the folks that we're working with, our partners, so that we can inform the community, because that's what we do best in public health. Primary prevention is making sure that people have information and that they're aware. So she sent this information out with regards to the CDC's interim public health recommendations for fully vaccinated individuals. And this is now what our state is recommending at the New Hampshire Department of Public Health and Community Services, or Department of Health and Human Services, as well as what we're recommending in Nashua as well, because we do try to align our recommendations. The CDC has added that fully vaccinated people wear their mask in public indoor settings in areas where there is substantial or high transmission. And again, the reason is to deter or lower risk of transmission. All people, including fully vaccinated, should wear their masks in these settings, and also use other metrics, right? And so social distancing, which we were talking about before, making sure that we do that as well. In places in New Hampshire where we have counties that are listed as having moderate substantial spread. So right now, for the most part, across the state, many of our counties are still at minimum, except we have a few that are at moderate, and I'm sure you're going to show that map as well. We want to make sure also that regardless of levels of transmission, the CDC also recommends that, like you mentioned, if there are individuals that are immunocompromised, that they also wear their mask. Or if there's someone in their household that's immunocompromised, because again, you don't want to bring this variant or COVID back into the home for those who might be at increased risk for severe disease, because then it can lead to those things that we don't want, which is hospitalization or death. Fully vaccinated people can choose to wear their mask when in public indoor locations, even in lower community and in lower levels in community settings. And so basically what we want is for people to take responsibility, for themselves and for the health of those that are around them. So we're really looking for all of us to be compassionate and caring for all of the individuals, that we live with, that we play with, that we work with, right? Because we don't want to go back to where we were previously.
So I've observed something very interesting, and I think all of this messaging is very tricky. I'm just going to put it out there.
Oh, yeah.
It's tricky because I've spoken to some of my peers, and they say, well, I'm not wearing my mask when I'm shopping right now. But then I think, because if I do wear my mask, people will think I'm not vaccinated, and I don't want them to think I'm not vaccinated. And so there's a lot of kookiness in people's heads about overthinking this, and I just, in my mind, I've never taken my mask off in the grocery store. I can't do it yet. I still think that when you're in those spaces where you don't know the people, you don't know where they've been, and it's crowded. I mean, let's face it, we got to wait at the deli counter, wait at the fish counter, and the grocery stores have also eliminated a lot of their arrows. People aren't going in the same direction anymore. So I feel like people should still wear their masks in those kind of settings.
You know what? It's this whole concept of just taking universal precautions. You know why? Because again, you don't know who's vaccinated, and you don't know who's fully vaccinated, and you can't walk up and card people.
Right.
Let me see your vaccination card.
With a little radar.
Right. And you know that's really not necessary. But what you do want to do is, take responsibility for your own health. I wear my mask still, in the grocery store as well, Jane. I'm fully vaccinated, but I also want to make sure. Again, that I'm setting an example. I do it for my whole family is vaccinated. Everyone, even people in our home that are immunocompromised. But I still do it just for, again, setting that example. Because what I have found is, some people might do some mask shaming,
Well,
or feel that way,
it's just true.
right? And so, you know what? When I found that sometimes when I have my mask on, other people will put theirs on as well. So it's setting that example. And we don't want people to fear, what other people are thinking, whether they have it on because they're vaccinated or unvaccinated or not. We just want people to be cautious and careful, and we also want to prevent further spread of
right, and that's the
anything.
bottom line.
That is the bottom line.
And you know, it is a very effective vaccine, but it's not 100%. And so, you know, if you're going to have that, I've spoken to people, if you're going to have that close contact with someone, even if you're vaccinated, you know, you are at risk. So,
Yeah.
you know, but the one thing I do want to mention about the vaccine, you know, while we're on that topic, is that what we're seeing is that well over 97% of the people that are in the hospital or having severe illness have not been vaccinated. So we know that this vaccine is effective.
Right.
We know that it's reducing that severe illness. So you may have a COVID diagnosis with the vaccine, but it's not. You're not going to end up in the hospital.
Right. And that's our expectation with how vaccines work. Even if we think about, for instance, the flu vaccination, right? So we encourage people to get vaccinated by the flu, and that is coming up. So we're in August. We're getting ready to go into our flu season. Which is another reason why we want people to take advantage of getting all the vaccines that they need to get to prevent against either influenza or COVID or any other vaccine preventable illness that is out there. But even with the flu vaccine, we know that some people still may catch the flu, but it's not as severe as if they didn't have the vaccine itself. And so with COVID vaccine, it's the same thing, right? We're trying to prevent hospitalization and we're trying to prevent death. And individuals that may have COVID infection after vaccination, it is less severe. And we don't see those folks necessarily, you know, in the hospital or, you know, dying unless they have some other immunocompromising situation that complicates that, right? So the vaccines are as effective as we want them and need them to be to prevent hospitalization and to prevent death.
And even with the flu shot, you know, we there was a big push, of course, last winter to make our fall and winter to get that flu shot. We had very little flu.
You know why?
Because we
Jane?
all wore our masks.
Exactly.
I kept thinking, I spoke to my hairdresser. She goes, you know, I haven't been sick. I haven't been sick. She goes, you usually get 3-4 bad colds. I mean, I haven't had a sniffle, those kind of things. So, I mean, the masks work.
People were doing a bunch of things. Masking, washing their hands. They were keeping their distance. People, all the things that we wanted folks to do. You know, if you're sick, stay at home. For those that did happen to venture out, if they encountered people that had their mask on and doing their hand washing. In flu season, that was always our big mantra. Wash your hands, right? So those mitigative measures really did help. And it did lower the flu season rate. It really did.
It was incredible.
It was absolutely
virtually
amazing. And so we do want to keep those things in mind as we come into this next season, flu season. We want to keep those things in mind as well.
Yeah, we've talked about immunizations today, so mostly for kids, but you know, for adults and for children, getting that flu shot is really going to be important this year, just as important as it is every year. And last year, it is very important just to minimize that illness burden.
And Jane, you mentioned, you know, our children. So we know that our vaccine right now has been approved through the emergency use authorization for adolescents 12 and up. Right now we have a 6% vaccination rate for our kids between 12 and 18. We really need to see that
in
go
Nashua
up.
or statewide?
That's in the state.
Okay.
That's statewide. Our numbers for
30%.
Nashua and for the state sometimes seem to run concurrently, especially like even with our vaccination rate, you know, in Nashua and the state, they're pretty close, 58%, 55% for those that are vaccinated. But we really want to see that number go up, especially because we're getting ready to get back into the schools.
Right.
So we want to see that number go up so we don't see, you know, COVID cases in the school. We definitely don't want to see Delta variant cases in the school either. So, because again, we also have adults in the school. We've got the teachers, we've got the, we've got
And
folks
a lot of
that
staff.
we want people to be protected, right? So, as these opportunities present, you know, we really want for all of those that have been approved to get vaccinated, that can get vaccinated, to go ahead and do so. So make those appointments. You know, visit us at some of the sites where we are going to be, you know, to offering vaccinations at the library, at the public library, during our immunization clinics. We want folks to go ahead and take advantage of that. We want to be prepared, right, for those things that we don't know what's coming down the pike for, but we can be prepared for it. We don't want to see those numbers to continue to go up. That is very disheartening for us right now in public health.
Yeah, because we've come a long way.
We have come a long way.
You know, we're kind of numbers. I mean, I check it every day because it's just I mean, I guess because I work in public health, but
Yeah.
I like to know what's going on and, you know, what the day is going to look like ahead for us, whether we're going to be responding to this, you know, bump or not.
Yeah.
And so we do check it quite often because, you know, even if our positivity rate is still relatively low,
It's doubled,
it
though.
doubled.
It
So when
doubled.
we see a rate double,
Right.
we get concerned.
And that's when we want to start early on taking the precautions that we need.
Yeah.
Right? And so we start pushing the messaging out for folks right now so we can leave it at a bump. Just a little bump, and then we started to take some action, right, to revert it so it doesn't turn into a spike.
Right.
A spike would be something that's ongoing. So if we get a bump, it's just a bump.
Right.
Let's
We're
keep
going
it at
for
a
the
bump. We're going for the bump.
Going for the bump. So just to review, just really briefly, what's going on in Nashua. We always do a data update in our newsletter, and we like to share that with people here that we have 31 active cases right now, but our new infections per 100,000 is 56.9. So again, we're above that 50, which, you know, again, changes our colors. And as much as we like colorful things, we prefer green, so that we've got that green light to do things. And our 7-day total test positivity is 2.7%, whereas like you said, last week it was 1.3%. So put your masks on, be careful, you know, make smart decisions, keep washing your hands, and we're not going to go, if all goes well, we're not going to go way back. So, but we all have to be part of the solution.
Right, we do.
We all have to take our steps. You know, we have to protect our friends, our family, our neighbors.
Our businesses,
yeah.
our economy. If we think back to how COVID impacted the nation and the world, so that's how serious we need to take this, right? There was a huge economic impact with COVID when it got to its height. Right now, we're seeing numbers that look like what we did in May. So we don't want to go backwards. We need to continue to go forward. We all need to think about being a part of the solution. And a part of that means masking when we need to mask, right? Social distancing when we need to. Washing our hands every day. That should just be a given.
That's basic.
That should just
We've
be
been
a
asking
given.
people to wash their
right?
hands forever.
But just being
Yep.
mindful of the impact that this pandemic has had on our economy, on our families, the social isolation. We don't want to go back there.
Right.
We don't.
Right, and it has been really interesting. I had the good fortune of being able to travel a tiny bit, but you could see the repercussions everywhere. You know, people, and we read about this in the newspaper, but being short-staffed, and you know, restaurants closing on certain days because they can't burn out their staff. I just read something now that we have a shortage of bus drivers in the state of New Hampshire because people are, you know, either leaving the workforce or worried about this. So if we need to, in order to get back to normal, or a new normal, we really still need to all do our part.
Yeah. Be a part of that solution.
Yeah, part of that solution. We have a nice little button that we wear around. So just a little bit on vaccines. So right now, 66% of those eligible in New Hampshire have had one dose of the vaccine. So that's good. Hopefully they'll continue to go. So, and then fully vaccinated, of those eligible, because if you're younger than 11 or younger, you are not eligible. But we have 60.9% in the state of New Hampshire. A little bit less in the city, so we do have some work to do.
Right.
And that's really, you know, we're just going to keep offering those vaccines until we can.
We want to get there because for those who can't get vaccinated, if we increase the number or the percentage of those who can get vaccinated, we protect those who can't. And we also decrease the amount of virus that's in our communities. And so, yes, let's all be a part of the solution. Let's all focus on just having a bump and not a spike. Let's all go back to thinking about those mitigative measures seriously so that we can help maintain where we are right now and not let it get any worse than what it is right now.
Right.
And so even though the numbers have gone up, the percent positivity rate is doubled, it's still at a manageable place right now. Our hospitals aren't being taxed. Our staff, our nurses right now aren't being taxed, but if these numbers continue to go up, then we'll start to feel that even in the workplaces, right? So we just all want to work together to be a part of that solution.
Right, and speaking of being taxed, like when we were in the height of things, it was all hands on deck. You just did whatever you had to do just to manage the pandemic. And now it's like a great pleasure to take a step back and say,
breathe.
Hey, we do other things in public health besides pandemic management.
We do.
You know, we work on a community health improvement plan. We're able to take a look inward and work on our strategic planning. We just do, our mayor's opioid task force has been able to reconvene.
All of these
and
meetings
really,
have been able
you know,
to,
they've all been going on
yes.
via Zoom, but you know, we've actually had an in-person meeting at Public Health, you know, addressing issues around youth
Yes.
and behavioral health. And so that's the stuff we want to get back to because that's equally as important
Right.
as managing the pandemic.
Right. And we have the month of August is full of wonderful activities in the community, right? So we want to be able to continue to move forward with those types of activities, with planning those type of events, and we don't want to see that change.
Right. We have a lot of outdoor things. We were talking today. We have the Brazilian Festival. We have the Back to School event. We have National Night Out.
I know. I call it Nashua Night Out, but it's a national event.
It's a national event.
And Nashua partakes in this national event that's done with our Boys and Girls Club and our Nashua Police and First Responders. And so, again, all of these great things that we get to do in our city and in our communities, why would we want to jeopardize that?
Right.
Right? So let's just continue to do what we need to, put those measures in place, do the things that we need to make sure we can continue to go forward.
Yeah. So it's a great message, and I thank you, Bobbie, for being here with me today and for all you do for our city and your evenness, and you never break a sweat. So we really appreciate that, your leadership in our community.
Oh, I enjoy this team. It's a fantastic team that we have working together. And it has been, as you said, Jane, all hands on deck with our health department, with all of our community partners, first responders, city officials, government officials. It has been, I'll tell you, that pandemic, you know, rocked us, but also allowed for us to see the resiliency that we have. But what we want to be able to do is we want to be able to move forward from that. We'll still work together. We'll still be great partners.
Yes, we will.
Let's do it doing some
we know
other
how
things.
to find them all now.
Exactly.
So just a little reminder that if you have not had your vaccine yet, you can go on vaccines.nh.gov. They're very accessible. There are a lot of places that are taking walk-ins. Don't hesitate. It's not scary. It's really going to protect you, your family, and our community. And we'll see you all next time.